All right, well, Valentine's Day may technically be over, but there's still plenty of reasons to take care of someone you love.
Well, in this case, that someone we're talking about is very close to you. It is yourself, because every 60 seconds, a man or a woman dies of heart disease. A local woman I met has become an advocate for heart-healthy education for women especially, since many women ignore the warning signs just like she did. Her wake-up call is today's What's Your Problem? Appearances can be deceptive. Gail Alexander Wright knows. 5 years ago, she looked physically fit. She easily was able to run 1.5 miles in 11 minutes flat. But on November 7th, 2007, she learned that wasn't enough.
I was 37 years old and I had a heart attack.
Were you feeling symptoms months before?
Yes, I was.
You were?
I was.
Oh, that you ignored?
I ignored. I remember being under a lot of stress and just feeling very tired. Before the heart attack, about a month leading up to then, I would feel pain on the left side of my neck. I thought I needed to buy better pillows because my pillows obviously weren't, holding up to the standard that I thought. And then I remember it went from the neck to, the center of my chest, but still didn't think it was a heart attack. I had just started back to working out. I was guilty of the microwave dinners that were supposed to be diet friendly. So the night of the heart attack, wouldn't you know, I worked out, got off from work, worked out. This was about 6 o'clock in the evening. Sat down to eat one of my microwave dinners. Salisbury steak and broccoli was what was in the contents there. Sat down to take my first bite, and that's where I felt the pain that everybody talks about and the pressure. And it felt like my chest had caved in. I could barely speak.
Gail's daughter called 911, and Gail learned her heart attack was caused by a blood clot that disrupted the flow of blood to her heart. She didn't need surgery, but here's where family history can't be ignored, and Gail says she really needed to take some extra precautions. 13 months after her heart attack, Gail had a stroke.
We can't change who our family members are and how, these diseases affect our family. When you say my father and his father, and all of my father's siblings had heart attacks or strokes before the age of 30. That's the extent of my family history. I thought that you'd have a headache or something like that. I never had any headaches. It was just the blurred vision. I remember having a bottle of water in my hand, and I was on the phone with my sister, and I dropped the water bottle. And I thought I dropped it. But now I know it fell out of my hand because my right side of my body started to go numb. Even though we as women, we like to say, oh, it's nothing, we are the ones that are dying at an alarming rate because of not going and getting it checked out.
Sentara cardiologist Dr. Jaime Murillo says more than half of congestive heart failure deaths are women, and that the majority of women don't have the typical heart attack symptoms.
That's a huge number of women that may have heart disease and they don't realize it. So they tend to ignore it, think it's stress related, think there's something else, and they don't seek medical advice sometimes. I tell my patients in the office, I'd rather see you here and tell you don't worry as opposed to say you came too late. You should have come sooner than you came.
Gail knows she's been given a second chance, but life is not what it used to be. Exercise is no longer an option but a requirement, and she must take medication for the rest of her life.
For me, it's a way of life, but I try to get the word out to tell people you don't want to be on this side if you don't have to be.
Now, Gail mentioned she worked out quite a bit before her heart attack and stroke. Despite that, she still had that heart attack and the stroke, but she didn't have to have heart surgery and doesn't have any long-lasting effects from that stroke. That's likely because she was so physically fit before all of this happened. Now, before I go, I want to run down some of the symptoms that may not seem like heart-related symptoms. You hear plenty about that chest pain, but many times this heart disease, the warning signs are a little more subtle, like shortness of breath with any sort of activity, fatigue, just not feeling right. I mean, that is a symptom. Indigestion, sweating, nausea, pain, and I thought this was interesting, pain in the elbow, in the earlobe, or the jaw. So something that you might not necessarily think is heart-related, it just may be.
Interesting. All right, some great tips. Thank you for that, Cher. Appreciate it.